Good day, dear students. In current lecture, we need to discuss a unique group of bacteria, which is known as atypical bacteria. And they call so by several reasons. They have a few properties which make them differ from other bacteria. So, first of all, they have a unique way of life. They all are parasites, and they depend on the host cell. Means they need a live host cell, eukaryotic cell to survive by several reasons we will discuss in lecture later. So first of all, it means they all can survive only within animal or host body, and they cannot be cultivated in cell-free culture medium because they always need a cell. Few exceptions as well are present, but it is an exception. Second, they have nature. They have so small size they can pass through bacterial filters. And previous years, when viruses were not discovered, actually they're smaller than usual bacteria, and any attempt to remove those bacteria, those agents from liquids, were unsuccessful, and people thought that actually that bacteria is a virus. But if you discuss, and when we will discuss structure of those pathogens, they really have common structure of bacterial cell. They have organelles, and they have ability to multiply independently, and they still belong to bacteria. So we have two main groups. First group is a group of obligate intracellular parasites. We have two main genus is Rickettsia and Chlamydia. And first of all, we will discuss Chlamydia. It is bacteria, you can see it in electron photo. And nowadays it is belong to family Chlamydiaceae, and actually it is subdivided into two different genus, as you can see, Chlamydia and Chlamydophila. But that reclassification occurred recently in some of your Paniker books. That bacteria can be described as one genus, Chlamydia, and all three species belong to Chlamydia family, Chlamydia genus, sorry. But nowadays there differs, and we have the only species Chlamydia trachomatis in Chlamydia genus, and Chlamydophila pneumonia and Chlamydophila cetacea now belong to separate genus of bacteria. So bacteria by its nature is gram-negative, very small in size, non-motile, non-capsulated, can have different shapes, and actually that bacteria depends on the host cell because they naturally lack ATP synthetic system, and they cannot produce energy for metabolic processes themselves. But they have unique apparatus to steal energy from the host cell, and that's why they always live within eukaryotic cell. In cytoplasm, they have direct access to ATP of the host cell, and they steal it to produce metabolic processes in bacterial cell. So cell wall of Chlamydia naturally lacks peptidoglycan, and it is one more unique property of that bacteria because any other microbe have peptidoglycan in the cell wall. And of course, if bacteria is in clinical sample is always located within a eukaryotic cell, then gram staining technique is useless because it cannot identify bacteria which is trapped in eukaryotes. And usually for staining of clinical sample, we will use James or Jimenez staining technique. It is shown in the center of the slide, and you can see bluish color, some cytoplasm of the host cell, and those kind of balls of red color looking like maybe a brain or something. It is an accumulation of chlamydial cell, which is identified as a purple or light violet color. So chlamydia, the only nowadays real chlamydia, Chlamydia trachomatis, till nowadays was identified only in human, and any disease caused by chlamydia always entrepreneur's disease transmitted only human to human contact. And of course, if it is difficult to recognize bacteria within cells in clinical sample, usually we're using not staining techniques, we're using immunofluorescence technique to identify that bacteria in slides. So nowadays, actually not even immunofluorescence, we have unique technique which is known as microimmunofluorescence. It is a gold standard of diagnosis in chlamydia. And as you can see on those photos, red or dark color eukaryotic cells are filled in with small green dots. It is fluorescent chlamydia cells accumulate within eukaryotic cells, and it is absolutely good seeing, easy to identify, even if it is small in size. That glowing, shining, and dark background is easy identifiable, and again, it is use of antibodies which are targeted only against chlamydia. So if you have that result, it is for sure identification, and antibodies, if they are species specific, you can identify species of chlamydia which is causing your disease. Besides microimmunofluorescence, we have as well common methods such as ELISA and PCR technique. And actually, cultivation is possible in eggs, in chick embryo, and cell culture lines are used in laboratories to perform some experiments and deal with chlamydia. But again, in routine laboratories, diagnosis will be confirmed with the molecular or some other additional tests without cultural properties. Another unique property of chlamydia, it is present in two different forms according to stage of life of that bacteria. So while bacteria is outside the host cell, it is called as elementary body. It is non-replicating but highly infectious agent which cannot perform any metabolic process, but it is very rigid. Cell will become more rigid, and that form is highly infectious because that form can pass through host cell and infect. So rigid cell will give high resistance to environmental conditions. Bacteria can survive in air and environmental objects for some time period. And usually when multiplication of the cell within eukaryotes is finished, that elementary body is released from the ruptured cell outside, and before infection, and that cell will be endocytosed by target cell and will be engulfed, and bacteria will go into eukaryotic cell. So when chlamydia will enter the host cell, it have access to energy, and actually factors inside the cell are very favorable for surveillance. It have a lot of water and metabolites, and bacteria do not need that rigid cell anymore. It will become thinner and will be transformed to a rod shape. As you can see in the right picture on the slide, RB is reticulate body. They became elongated, good stained, good visible, and that form cannot infect other cells, and actually it has very poor surveillance ability outside the host cell. But it can replicate, it can perform reparative processes, and can perform any metabolic activity because of multiple excess of energy. So we have different staining techniques to identify elementary and reticulate body, but both can be easily identified in microscopic techniques. So all diseases caused by chlamydia are usually divided into chlamydiosis. It is a type of disease which is transmitted through sexual contact, and again, causative agent is Chlamydia trachomatis. Chlamydia is bacteria which is transmitted by environmental contacts, means bacteria cannot invade, it can only stick to some surfaces. Chlamydia trachomatis is affine to epithelium, and actually cylinder epithelium. And bacteria can infect epithelium of urogenital organs, of our eyes, and of respiratory epithelium. And usually diseases caused by Chlamydia trachomatis are limited to those organs. It is sexually transmitted urethritis, it is eyes infection known as trachoma, which is actually given name for bacteria. And in newborn kids, that bacteria can cause damage of respiratory organs, but that one is not very frequent. So classic course is sexually transmitted urethritis, and if you remember first lectures, we talked about Neisseria gonorrhea, which causes classic urethritis with intense purulent discharge of yellow color, which resembles hyperactivity of sexual glands. So diseases caused by chlamydia, and later we'll talk about mycoplasma. They are very frequently called as non-gonococcal urethritis or atypical urethritis, because in that case, bacteria causing very poor discharge of pus mixed with the mucus. It have transparent or kind of milk white color, and intensivity of the disease is very low. Mainly it is kind of chronic or subchronic duration of disease with latent course of infection. And by those reasons, disease is called non-gonococcal. And if you have a patient with some urethral disorder, infectious disorder, it is always the very first task to put the diagnosis to differentiate gonococcal urethritis or non-gonococcal because of different approaches and therapy and management of those people. So by nature of the disease, it's of course not dangerous. Simple urethritis can be easily identified and treated. But because of latent course, patients very often will not know that they're patient. They will suffer from some symptoms, and they will go with the disease, or they will live with the disease for multiple time periods. So during prolonged course of disease, bacteria can slowly invade by way of urethral channel to deepest organs, and in men usually causing such disorders as strictures of urethra by formation of fiber tissue. Chronic inflammation will lead to replacement of epithelial tissue with fiber tissue, and can lead to strictures and narrowing of the channel in urethra. It can lead to prostatitis and orchoepididymitis, and in women, chlamydia trachomatis is associated with pelvic inflammatory diseases or PIDs. And the same problems, epithelial tissue will be replaced with scars, and it will lead to commissures in sexual organs. If the disease will develop or will occur during pregnancy, it is dangerous because of possible abortion of affection of fetal tissues and placental tissues. It can lead to spontaneous abortions or birth defects, stillbirth, and in newborn kids, if infection occurred in late stages of pregnancy, it can lead to serious disorders, or even if some kids are infected during birth delivery. It can lead to conjunctivitis, pharyngitis, bronchitis, and pneumonia. Again, mainly kids will engulf bacteria, aspirate bacteria during natural birth delivery, and with the mucous secretion of mothers' pathways, bacteria will be inhaled by kids, and here have perfect abilities because actually structure of epithelium in respiratory tract and urinary tract is similar. We have few associations of different disorders caused by Chlamydia trachomatis, and the most known one is Rickettsia syndrome. It is a triad of damages caused by Chlamydia trachomatis in one person. Initially starts with urethritis, then later complicated by conjunctivitis and even arthritis. If you have all three syndromes caused by the same microbe, Chlamydia trachomatis, in one subject, the diagnosis will be pronounced not as chlamydiosis, it is a Rickettsia syndrome. And in women, we have that Fitzhugh-Curtis syndrome, which is association of pelvic inflammatory disease initially originate from sexual organs with inflammation of liver capsule, leading to adhesion of organs between them. And that syndrome again is caused by initially Chlamydia trachomatis. So one unique disorder caused by Chlamydia trachomatis, and it is a very first described disease for chlamydia. It is trachoma itself, given the name for the species of bacteria. Again, disease is identified only in humans, and actually can be transmitted by flies in poor countries and African countries where people have very low level of hygiene, or they have windows without glass open, windows open, doors because of very hot climate. And during sleep or during some hygienic procedures, those flies can be attracted by liquid in eyes, and they can transmit bacteria from one person to another, but usually within one family, because bacteria cannot survive for a long time period and pause of the flight. So again, as we said, affected population, usually some communities with very low hygienic measures, or such poor countries who have no money even for common measures of protection against flies. And initially, disease will manifest with the inflammation of eyes of conjunctiva, or even sorry, not conjunctiva, sclera. But that inflammation will lead to very chronic duration of the disease, because people again don't have sufficient money and ability to perform hygienic measures and perform proper treatment. And that constant inflammation slowly will lead to formation of scar tissue, fiber tissue on eyes, eyelids, and sclera. And that scar tissue will slowly damage and trauma eyes tissues. And with the time, that constant damage will lead to cloudiness of cornea. And as you can see on the left picture, the whole area, which should be absolutely transparent, will become non-transparent, it's opaque, and of course it will not pass the light in eye, and it will lead to the blindness. So as far as disease is chronic, usually that blindness will occur in many years after disease onset. It requires a lot of time to form enough amount of scars on the eyes, damage tissue, and lead to serious cloudiness. It's very rarely observed in kids, but actually first episodes of the disease will occur in the kids' age. But that blindness will develop only till some mid-age or even in elder people. And that type of blindness is reversible, because actually only transparency of cornea is the reason of blindness. And nowadays, trachoma is in top one reasons of reversible and preventable blindness. But again, because of very poor level of life in those countries, they have no significant money to perform correct treatment, and of course, they cannot afford plastic surgery to replace, to transplant new cornea. So, second disease, even caused by Chlamydia. Now it is reclassified. Previously it was chlamydia. Now chlamydia pneumonia, as it's obvious from the name, that bacteria is causing pneumonia. Again, identified only in human, and transmission only from human to human. In nowadays, about 15% of all community-acquired pneumonias, according to WHO, are caused by chlamydia pneumonia. So waste transmission is obvious, it is air droplets, but as far as bacteria can survive in environment for some time period, that disease can be transmitted through dust particles after coughing and sneezing of the people. They can left aerosol, and those particles of saliva will mix, or mucus will mix with the dust particles, and bacteria can remain in the air even if subject is already gone from that room or some object. One property of any chlamydial disease is very latent and prolonged duration. In the contrast with classic bacteria, with typical bacteria, when acute of diseases, onset of disease is acute and duration is acute. Chlamydia causes very low intensity of the diseases, and incubation period can last up to a month. In main course of the disease, we have no unique symptoms. Usually it is some symptom of respiratory disease, but again, cough is rare and not very deep, not very severe. Production of sputum is low, discharge is low and usually mucoid without any purulent inclusions. And if you perform any examination of blood, such as a blood cell count, then you can have some changes, but they are not very indicative for bacterial disease, but they will not be normal as well. They're elevated, but slightly. So chlamydia pneumonia is mainly affecting kids population because of frequent and prolonged close contact. And usually kids cannot explain and cannot tell you any problems they have. They don't feel their disease, and usually they just have some spontaneous rare cough, and that's all. And disease should be identified only during some routine checkups, or if you identified one ill kid, of course, it is obligatory to check other kids in the kindergarten group or in the class if it is a school kid. And every contact kid should be tested for that bacteria as well. Chlamydia citata is causing psittacoccosis, or in community is known as a parrot disease. Disease is naturally infecting different types of birds. It can be domestic poultry, it can be some home-kept birds such as a canary or other. And disease is usually transmitted by air dust way, means that birds will spread the bacteria in air, and as well that microbes will stick to dust particles and can circulate in rooms for some time period. Or disease can be transmitted during close contact with especially parrots or canary, when those birds are feeded with the mouth of the owner. Very often, owner will take some bread or some other food in mouth, and they feed it birds like that close contact, and bacteria can be transmitted during those contacts. So incubation period again can last for up to almost 3 weeks. And in the case of psittacoccosis, we will have acute onset of symptoms such as fever and headache, maybe pain in muscles. And slowly, in several days, respiratory systems will be involved, such as lungs. And in a week after the onset of the disease, hepatosplenomegaly can be observed in those people. So for about 10 days, fever and some common symptoms will be observed in those people, but later disease will decrease in symptoms, and only some disturbances in internal organs can bother patients, and usually it lasts up to 3 months, not more. And in rare cases, we had description of meningitis as a separate isolated condition, but it's not a common thing for psittacoccosis. And the most dangerous complications of the disease described in literature sources, it is thromboemboly of blood vessels, which can lead to serious consequences such as strokes or blockage of respiratory blood vessels. It can be hepatitis, acute heart failure, or just damage of heart muscle with corresponding symptoms. The main problem is we don't have any vaccine available in any country for disease, because actually immunity after disease is not formed. And again, repeated and secondary infections are highly possible. And if it is a parrot disease, then the only way of prevention is regular checkup of birds in veterinary doctors and treatment if required. But all measures of prevention disease are only non-specific, means that common hygiene measures should be followed. Washing hands, if someone is ill, wearing mask. Doctors, of course, during investigation of people during checkup should wear protective mask, and gloves is required. But actually, that's all. If you talk about sexually transmitted disease, then of course regular checkup of yourself or of sexual partner, and if it's not possible, then barrier measures of contraception. Pregnant women should be checked up during it's better even before pregnancy, during pregnancy, and of course newborn kids, if mother was not checked, should be studied as well. For diagnosis of the disease, we already said that cultural method and classic bacteriology is not applied here. We have almost the same techniques. As we said, PCR is highly used nowadays, and actually any laboratory you will attend will use that PCR technique. And it is fast, precise, kind of cheap, and can be used as a reference method. But we still have that ELISA test to identify antibodies against Chlamydia trachomatis, and it is rarely used, but still used by some laboratories, especially when PCR technique is not available by the reason of initial price of equipment. We have the same rapid immunochromatography tests. It is a common technique with that plastic cartridge and filter paper with membranes of known channels, pores of known size. We need to take samples from the patient. We have usually tests to identify antigen. It is a cervical swab, urethral swab, or some discharge from the eye. Add on that sample window, mix with few reagents, and again that strips of control and test will appear. You can identify pathogen very easy and fast. So in some cases, we have combined test systems when most frequent pathogens causing urogenital infections sexually transmitted are combined in one test system. You have more than one window, or if it is ELISA, you will have different enzymes in different colors for different pathogens.